Hi, everyone. I had the opportunity to interview Michelle Blood, a registered dietitian who currently works in community nutrition at the Monroe County Office for the Aging. I wanted to learn more about what this field looks like in practice and specifically how evidence-based nutrition becomes translational when it's applied to real communities. I started the interview by sharing a bit more about my background and that I currently work at an inpatient psych unit, and that experience showed me how a lack of resources and community support can directly affect health, especially among older adults. From there, I asked Michelle how she got into community nutrition and what her career path has looked like. She originally received her associates as a pastry chef, but eventually graduated from RIT with her bachelor's in nutrition sciences in 2017, and she completed a dietetic internship at Syracuse University. She started working in long-term care, where she said that the nutrition environment is very structured and controlled in more of a clinical setting. But during COVID, she transitioned into community nutrition, and that's where she's stayed ever since. She told me that while long-term care was predictable, working in the community allows her to make a bigger difference because she's reaching people who might not otherwise have access to professional nutrition support. I asked what a typical day looks like for her. She said that no 2 days are generally the same, but she does oversee 19 different community centers, and that her responsibilities include completing nutrient analysis of menus to make sure they meet 1/3 of daily requirements, and ensuring food safety compliance, which I thought was interesting to learn about because I didn't think that would be something that would fall under her job description. She also provides nutrition education and writing monthly articles for the community. She also conducts education sessions about 6 times a month, which could involve presenting to older adults or the food service staff. One of the things that she enjoys the most is variety in her field, and she gets to work with families and center directors and older adults, and that she's constantly adapting to the community's needs. She was candid about the challenges. She mentioned feeling imposter syndrome at times, especially when she first entered public health nutrition after coming from a more clinical setting. She also talked about how funding is always changing. She mentioned the Older Americans Act, and which dates back to the 1970s and how they're protected under that, but recent financial cuts have made it harder to maintain the same level of services. I asked her what kind of people do well in her field and what skills she thinks are most important. She said that a key skill she believes is communication and being able to engage with people from all different backgrounds, whether that's older adults or their family members or the food service workers. She said that community nutrition is really about meeting people where they are and helping them make small and sustainable changes. She also pointed out that there's not a shortage of jobs in this field and that communities always need nutrition professionals that are approachable, flexible, and compassionate. As we wrapped up, she shared that while she valued her time in clinical care, she feels like she's making more of an impact now, and working in the community allows her to directly influence food access, education, and the quality of life of the community members, and that she feels like that's deeply rewarding for her. This interview gave me a clearer picture of what community nutrition looks like beyond the classroom, and it has allowed me to connect what we've been learning. It's dynamic and people-centered, and Michelle's perspective reinforced how important it is, and also how important communication, adaptability, and resourcefulness are in public health nutrition, especially because of the continuous funding and policy changes. And I really enjoyed this interview. She was very nice, and yeah.